Imagine walking into a hospital and hearing your tests came back, but they don't quite add up. This chilling reality is more common than you might think. Every day, our systems analyze vast amounts of medical data to diagnose conditions, but hidden behind these advancements are serious risks tied to data synthesis errors that could jeopardize your health without anyone realizing it. Many people remain unaware that the very technology designed to help them may have flaws. A doctor might rely on an eye model that is incorrectly synthesizing data. Can you grasp the consequences if your diagnosis is based on misleading information? Picture yourself in a waiting room, anxiety building. You were promised that I would simplify everything, but what if it misinterprets your symptoms due to incomplete data? That's a terrifying possibility. Data synthesis errors can be subtle, sneaking in when algorithms merge data from different sources. For example, a hospital in one city might use different standards than another, leading to confusion and ultimately misdiagnoses and inappropriate treatments. You trust the system, but it has blind spots. A small error in data can escalate into a serious misinterpretation, leaving you with a prescription for a condition you don't even have. The stakes are alarmingly high. Real people have faced unnecessary surgeries or harmful medications because of these hidden errors. It's like a ticking time bomb in healthcare. But what if you could spot the warning signs? Trust your instincts when something feels off. It's crucial to question your diagnosis and seek second opinions. In a world where AI is increasingly influential, awareness is your best defense. You have the power to advocate for yourself, don't fall into the trap of blind trust. As you engage with medical technology, remember the potential for error. It's not just about accepting what you're told, it's about taking an active role in your health. Stay curious and vigilant. Your well-being could depend on it. If you found this information eye-opening, share it with someone who needs to hear it. What if your doctor's diagnosis was based on faulty data? Imagine trusting a machine only to find it led you astray. The hidden consequences of errors in data synthesis for ignorated medical diagnostics subtly affect our lives in ways we often overlook. Many people assume AI is infallible, but what happens when it makes a mistake? Picture this: you go in for a routine checkup. Suddenly, anxiety washes over you. But what if that alert was triggered by a glitch in the data synthesis? You might never know. These errors can stem from various sources: flawed algorithms, incomplete datasets, or even inherent biases in the technology. It's a complex maze, and you find yourself navigating it, relying on decisions made on shaky ground. Now let's take a moment to consider what's truly at stake. Imagine a young parent receiving an ignorated diagnosis suggesting their child has a serious illness, only to later discover that the data leading to that conclusion was flawed. The emotional toll is devastating, but the consequences run even deeper. Consider this real-life scenario: a patient was advised to undergo unnecessary surgery because they misinterpreted their scan results. The stress of facing surgery, the financial burden, and the lingering uncertainty about their health ripple through lives, impacting not just the individual but also their loved ones. As these stories unfold, we must ask ourselves, how often are we relying on algorithms that could mislead us? The truth is, data synthesis isn't just a technical issue, it's a deeply human one. It shapes our trust and influences our decisions in significant ways. So how can we safeguard ourselves from this hidden threat? Awareness is the first step. By recognizing the signs of potential errors, we can advocate for more rigorous checks and balances in eye diagnostics. Demand transparency from healthcare providers. Ask questions. Your health deserves more than a simple yes or no from a machine. As we navigate this innovative landscape, the stakes are high, and the choices we make today could shape the future of healthcare. So, as you finish watching this video, take a moment to reflect on your own experiences with technology and health. Are you truly informed? This conversation needs to continue, and your voice matters. Imagine a world where a machine alerts you to a health issue, only to discover that the diagnosis is based on flawed data. Scary, right? This is a reality in ignorated medical diagnostics. Many people see data synthesis as merely a technical term, but it conceals a serious problem. A simple miscalculation can lead to devastating consequences. It's easy to dismiss it as just numbers, but these figures can influence life-altering decisions. Picture yourself in a doctor's office, anxiously waiting for results. You trust the technology, but what if that trust is misplaced? As systems synthesize data from various sources, they can unintentionally combine information that doesn't belong together, leading to misleading conclusions that could alter your treatment path. Consider this: a patient diagnosed with a rare condition based on incorrect data might undergo unnecessary procedures, resulting in significant emotional and financial tolls. So, how did we get here? The issue lies in how data is collected and interpreted. Algorithms can be swayed by biases, leading to unexpected outcomes. Now, let's raise the stakes. Imagine you're that patient following your doctor's recommendations and trusting every word. But what if the eye behind that guidance was flawed? The potential for disaster escalates quickly, resulting in lost time, worsening health, or even worse outcomes. What can we do about it? Awareness is the first step. By recognizing that data synthesis isn't foolproof, you can ask the right questions about your health. It's about being proactive rather than reactive. In a world increasingly reliant on technology, we must stay vigilant.